Do we need to bring our catheter kit from home?
No. But if you have one, use it to get familiar with the stuff. Alright? So, hand hygiene, I've read my order. Place an indwelling catheter, and Miss Smith, I'm going to identify the patient, check her armband. I'm sorry, this is Miss Stewart, Mary Stewart. And she's, can you tell me your name and date of birth? Mary Stewart, 8/31/1936. Do you have any allergies? And that was one thing we didn't say with the meds, but ask for allergies. Okay? So let me add a little air to her first. You guys don't have to do this. This is just so I can make sure she gives us some urine. Okay. All right, so she's agreeable to her catheter. I'm going to position her.
Provide privacy.
Yes. On all of these, yes, provide privacy. Take off. So frog leg if you can. Be careful, these will pinch you. Alright, so you have two options. For you guys, I recommend that you use your tray table to the side. I've hand hygiene. I've cleaned her if she needed to be cleaned with soap and water. Okay. My kit, you're going to check the expiration date, make sure it's intact. You're going to remove this. You're going to take your bag, and they like for you to make a little trash bag. Wherever you're not going to have to reach across your field. You can put it here, you can put it there, wherever is going to make you happy. Okay? I have these two things here. I can't put on my sterile gloves until I have these dropped on my sterile field. Does that make sense to everybody?
Yes.
When I open this up, anything that falls over the edge is not sterile. I open it away from me first, then open the sides, and then pull back. Only touch the 1-inch border, correct?
Right.
Okay. So what I'm going to do is I have this little piece here, right?
Mm-hmm.
Okay. This side is shiny, this side is not. You're going to take it and bring that under the patient. But you can't reach back across, and where that folded on it, not good. Okay? So, the best way to do this, probably for you guys, is to come in and kind of drop that side and then bring that side. Okay? I'm going to have that under her hips. You can just throw your little drape out. Don't worry about that. Okay? What I'm going to do now, though, before I put my sterile gloves on, is dump my cotton balls and my Q-tips. And that didn't fall into my sterile field. I'm not going to reach in and grab it because I need to wait until I actually have it. It fell on my sterile field, but not on my kit. That would flip out. If you get one of these sticky ones like this, don't reach in to grab it. You gotta make sure it just drops out. Okay? These will go in my trash. Don't turn your back to your kit. And what I'm going to do now is bring my kit over here. Grab my sterile gloves. Hand hygiene. Open my sterile gloves. Remember to grab at the cuff. And if they do that, don't flip out. Just put your dominant hand on first.
So you put the
And you see
sterile
how I'm
field
kind
down?
of, I'm still a little goofy? That's okay.
So would you pull the gloves out first before you put the sterile field between their
You
legs?
can
or
if
does
you
it matter?
want.
It
It doesn't
doesn't
matter.
matter. Oh, okay.
I'm not going to count you. And then I put this one on. Although I want to grab that and pull that up, I'm not going to. Just going to position it this way.
Avoid the urge.
Yes. Okay. So now I'm sterile. Whatever I touch has to be sterile. So I'm going to separate these two. I'm going to kind of turn this a little bit this way. I'm going to put my cotton ball now here. Okay. So I'm going to attach my balloon port. I'm going to take the gel. I'm going to squirt it in here. In real life now, we're putting it in the meatus. We're also, especially on male patients, they're not going to test you on that here. I'm gonna pretend to open up my betadine and pour that on top of my cotton balls. Alright?
Are we gonna pretend to?
Yes.
Okay.
So, got this. If you want to put this in the trash, great. If you want to risk breaking your sterile field, that's perfect. Go ahead. I don't mind. But you risk breaking your sterile field. I just would set it for you because this is still sterile. But you can put it in the trash, but students break sterile field when they start trying to put too much junk in the trash. Alright, so I have this done. So what do I need to do next?
Clean.
Clean. So now I'm gonna have to make this hand, and I want to so bad pull my sleeve up right now. Can't do it, okay? So you're gonna open up the labia, and you're gonna take your cotton swab and go down one side, place it in, go down the other side, place that in, go down the middle, place it in, okay? What I'm gonna do now is grab all of this, okay? And I'm gonna tell you to take a deep breath. And I'm gonna insert. I got urine back. I'm gonna go another inch. I'm going to inflate my balloon. I'm gonna disconnect and attach it to her leg. Okay? That's all it is to it. Then I'm going to I'm going to hang this on the side of the bed below the level of the bladder with no dependent loops. I'm going to clean the patient, reposition her, and provide privacy. I'm going to chart. What am I going to chart?
The size of the catheter, how much urine came out.
Cocoa.
Yeah.
So, okay, so you
Color.
would say you'd have your time and your date. You would have inserted and where you're going to find your French here, 16 French, indwelling catheter, inpatient, how much urine I got back, describe the urine, so let's say 100 mLs of, so you're going to have a graduate here, drain the urine that you get and measure it, and describe the color, so 100 mLs of clear yellow urine without odor, immediate upon catheterization. Patient verbalized no complaint of pain or discomfort during insertion. Okay. Then let's say the doctor has ordered me to remove the Foley catheter. I'm going to take a little 10 cc syringe again. I'm going to tell the patient what I'm doing. I'm going to insert the 10 cc syringe here. This is not sterile. I'm going to pull back until I get your 10 mLs. That's going to deflate. And if you take a 2x2 when you're in the hospital, it'll keep you from getting your, or 4x4, keep your hand from getting gross. And then you're just going to remove it, place it there, clean your patient. You're going to remove your stat lock by using some alcohol. The hand gel works really well to get a big goop of the hand gel and clean, and that'll peel it off. And you're going to dispose of all your things. The important thing is once you're sterile, stay sterile. Remember to put your cotton balls and your gel on the sterile field before you go. Okay?
So the removal's not sterile.
Removal's not sterile.
Where does the Foley stuff go? Like, it goes in the biohazard. Does it go in the biohazard?
Only if there's blood in it.
Okay. And the rest of it would just go in the normal trash.
Drain it of all the urine.